My name is Matt Mohebbi. I was one of the co-founders of Flu Trends, as Hallie mentioned, and current co-founder of Iodine. So when you hear the phrase published health data, what do you think? Well, some people think high-level information, like stats that you might see in New York Times. Other people are going to think lower level on the stack, like CSV downloads or tables. And you can actually create a hierarchy of this data, going from stats all the way down to raw data. And one of the important things to think about when you're looking at a hierarchy like this is that it's relatively easy to start at a low level and generate information for the levels above. So starting from something like data and generating charts from it. But it's hard and sometimes not possible to go from an area high, like say stats, and generate information that's lower down. So those are two things that you should note. One, published health data means very different things to different people. And two, that there's a data hierarchy that has this data flow. So my background is in computer science. In school, I studied robotics. And in robotics, you see lots of open sharing of both code as well as data. And a lot of the data is shared at a very low, sort of raw or almost raw level. And so when I came to health, I was kind of expecting a similar sort of experience. And the very first data set that I came to was CDC's MMWR reports. I don't know how many in the audience are familiar with this sort of thing, so I'll give you a little bit of background. So these are the morbidity and mortality weekly reports, really riveting stuff. But it turns out there's by law, doctors in the United States, if they see a patient come in with a notifiable disease, there's a new diagnosis of a notifiable disease, they're required to report that information to the CDC. And this is tabulated in this MMWR system. So I was excited to find this system, to find this interface. I entered the MMWR year, MMWR week, and I got this HTML table. And sure, you can scrape this data. There's great open source libraries that now exist for doing this sort of thing. But I was a little disappointed that I just didn't have a CSV file that I could import into my system and start using this data. And if you search around on CDC for flu data, you'll come to this chart. This is a chart of ILI-Net, which was touched on a little bit earlier. It's a sentinel network of physicians in the United States who, on a weekly basis, report the number of patients that they saw and the number of patients that they saw with an influenza-like illness. And this information has been tabulated by CDC for many years, as you can see. And so if you wanted to download this chart data, you might see that beautiful View Chart Data link on the bottom. And if you click that, you again get an HTML table of data. So no CSV data in there. So again, you have to create a scraper to pull this data out. Now, another thing to note about this table is on the far right, you have percent unweighted and percent weighted ILI. And this isn't defined anywhere in this table. You actually have to search around a little bit on Google in order to find the difference here. And on the far left, we have weeks. And in this particular year, the weeks go up to 52. But in some of the years, they go up to 53. And again, it's not defined. Why is that? Why is it in some years it's 53 and in other years it's 52? And you have to look on other parts of their weekly flu report in order to understand that this is actually an MMWR week. Well then, if you don't know what an MMWR week is, the next thing you do is do a Google search for that. And you find a 2-page PDF on CDC's website for defining an MMWR week. And I'll spare you on most of the details, but the most pertinent thing to remember is that it begins on a Sunday, and that Sunday is potentially in the previous year. It could be the 29th, 30th, or 31st of the previous year, as long as there are 4 days in the new year. So every person that is downloading this data, the first thing they're going to want to do is get a date. And in order to do that, they need to write a specialized import function to use the data. So I'm not here to bash CDC. I think that they actually do a great job of disseminating data through some of their networks. If you look to Europe with influenza data, you have the World Health Organization's collaboration with ECDC for Euroflu. And this network represents many member countries and over 900 million people. So it's a massive network. It's quite possibly the largest influenza network in the world. And again, it's really exciting. Get another one of these forums, and you hit the submit button, and you get a chart. And this is the lowest level of data that you can obtain online from Euroflu. There's a really promising looking link there in the lower right, the historic data link. Unfortunately, that takes you to even more charts. So one could imagine using these charts and using a tool like, say, Photoshop, and mapping the pixel space into real-world space. So you can map, as you can see here, the x-axis, the weeks, so the x pixels into weeks, and the y-axis ILI counts into actual ILI counts from the pixels. But it's not an easy process. And I imagine the programmers in the room are thinking about ways of using like Python image library and other tools for doing this, but it's messy. It's data janitor type work. So if you look south of the equator, it unfortunately doesn't get much better. So in this particular case, we're again looking at influenza-like illness data. And it says 1997, but it's actually going back to 1996, 1997 flu season. It's going all the way to present. So it's amazing to see all this ILI data in one chart. And another thing to note, although you can't quite tell from the screenshot, is that this was coming from a PDF. And the original form of this chart was vector-based. And because it's a vector-based chart, you can actually use a tool like, say, Illustrator to extract the information. So again, it's not the sort of work that programmers want to do, but if you need to get at the data, that's a way you can do it. So we spent a lot of time with Flu Trends looking at all the different systems that were out there that were providing data. And we did this because, as was mentioned earlier, we built a system that used search activity data as a proxy to measure influenza activity in the United States and 28 other countries. And to build out that system, we needed to select the search terms. And we selected those search terms through gathering ground truth data. So that's why we needed all this ground truth data. We used it as a filter on the search terms. And so through building out the system for 29 countries, we've looked at a lot of public health systems for disseminating data, and we learned a lot. And so when we built Flu Trends, we not only had really beautiful maps and charts that weren't designed by me, they were designed by our designers that have competency in that sort of thing. But we also had what I consider to be the most beautiful feature of Flu Trends. This. This is our CSV download. What we're seeing is CSV data for the United States, and we learned some things from the CDC process. So rather than having something like an MMWR week, we have the dates explicitly defined on every row. We also indicate that our weeks in the header start on Sunday, and that's midnight Pacific time. And you can also notice that we have lots of additional information that we provide in that header, and that information didn't come out in the initial version of the document. It didn't come out in the initial release. We actually got feedback from users, and over time, we improved this document. We improved the format to make it easier for people to use this information in a variety of ways. And in a way, we treated this CSV download the same way that we treated the rest of the site, as a product that should be iterated on. And the response from the users of the system has been phenomenal. We've seen people all the way from advertising, using Flu Trends data in order to figure out when they should launch their ad campaign with some influenza-related remedy, all the way to academics. In fact, there was one woman I spoke with who wrote most of her PhD thesis using this Flu Trends data. And in part, this is because of the usability of the data. So I encourage the data creators and data publishers and the audience to think about that data hierarchy when you're publishing your data, to think about the data usability, because it's a huge part of disseminating information online. It's not enough just to publish it. You got to think about your audience and the best way for them to use it. Thank you.